Welcome and thank you for joining our webinar today. My name is Taylor Gray Peel, and I'm the Diversity Inclusion Senior Program Manager for the American Hospitals Association Institute for Diversity and Health Equity, also known as IFDHE. Today, we'll be hearing from Kinsey Evans and Asha Rodriguez from Atrium Health on how to advance an inclusive workplace culture, equity, and commitment through system resource groups, also known as SRGs. You can expect our speakers to have the floor for about 40 minutes, and we'll conduct a short Q&A at the end of their presentation. If you have any questions during the webinar, please type them into the Q&A chat window, and we'll address them during the Q&A portion of the webinar. Before we get started, I just have a few housekeeping items. Please be sure to keep yourselves muted while our speakers are presenting, and the webinar will be recorded and shared via email and the online Health Equity Influencers Roundtable community post-webinar. By the end of today, we hope that you will be able to take the content back to your organizations and begin to implement the takeaways into your strategy as you all continue to advance health equity. We'll start with an introduction of our speakers. Today we have Kinsey Evans, who is the Assistant Vice President of Corporate Patient Access for the Greater Charlotte region of Atrium Health, where she provides leadership and oversight for the emergency departments, admissions, and outpatient registration sites. Advancing her career within the healthcare industry for the past 17 years, Kinsey has been tasked with influencing change, and she is known as a go-to leader for colleagues striving to reach their maximum potential. With a track record of developing leaders, Kinsey has served in various leadership roles within Atrium Health, including Assistant Vice President of the Professional Business Office in Charlotte, and she has enjoyed the privilege of leading more than 100 teammates. Her influence has had a deep impact on her colleagues and direct reports, with her contributions to executive decisions enhancing the ability to quickly improve performance. We also have with us today Asha Rodriguez, who is the facility executive of Atrium Health Carabas in Concord, North Carolina, a 457-bed not-for-profit tertiary regional hospital and part of Atrium Health. Asha has diverse and progressive professional experience, having worked in both nonprofit and for-profit managed hospitals and health systems, as well as in education. She leads with a disciplined approach to operations, budget control, strategic growth, and expansion of services. Prior to her current role, Asha served as Vice President of Operations at Atrium Health Carabas. Asha's leadership has propelled Atrium Health Cabarrus to new heights. I'm sorry. Please, hello, please put yourself on mute if you can.
Well, there's more to come.
Okay, Chief, you can figure out who that is and put them on mute. Thank you. Excuse me. So Asha's leadership has propelled Atrium Health Cabarrus to new heights, including being recognized by Newsweek and the Leapfrog Group as the best maternity care hospital in 2021, North Carolina's number 14 hospital in Greater Charlotte region's number 2 hospital by U.S. News and World Report in 2021, and achieving the U.S. EPA's Energy Star certification for the 4th consecutive year. She also led the build of a fully integrated $115 million heart and vascular tower, launched a successful orthopedic trauma program, and earned designation as a thrombectomy-capable center and advanced spine surgery center for the Joint Commission. However, her proudest accomplishment at Atrium Health has been leading her team and collaborating with community partners through COVID-19 pandemic. Without further ado, I would like to introduce you to Asha Rodriguez and Kinsey Evans.
And thank you so much, Taylor. That was a phenomenal introduction. I am so happy that you introduced me first because
Don't
Asha
say
is
that,
doing some
Kinsey.
amazing work in this space. Good afternoon, everyone. We're so excited to be here to talk about this topic because it is very near and dear to our hearts. And I want to personally say for me, it's an honor to share this opportunity with Asha Rodriguez. If you know anything about Asha, you know that she's been an amazing partner on this journey. And we're so fortunate and blessed by her leadership, her passion, and advocacy in this space. And so without further ado, I'm going to turn it over to Asha to get us started.
Absolutely. So thank you, Kinsey. Taylor and Ogechi, thank you for giving us an opportunity to share this. We're very excited to talk about this work. I think it is the linchpin to being able to truly create spaces where people belong and feel empowered. So let's go ahead and move to the next slide. I want to talk a little bit about Atrium Health for just a second. And Kinsey, I want to also, what I should have said when we started this introduction is Kinsey is one of the co-founders of this particular SRG. So as we get through the process of her walking through the mechanics of this, I don't want that to be lost, that this has been a personal journey for Kinsey and came at the perfect time for us as an organization. And we'll talk about that in just a second. But we are part of Atrium Health. We will remain forward-facing to our patients as such, but this SRG work now gives us a much larger platform to be able to introduce this type of work through this recent merger for us with Advocate Health. You all may or may not be aware of this, but we started out as Atrium Health, or Carolina's Health System moved to Atrium Health, picked up Wake Forest University School of Medicine and Wake Forest Baptist Health System, Floyd, Navicent, and now we are engaged in a really significant merger, which will make us the top 5 largest nonprofit integrated health system in the United States. So I'm very excited because I think this seed that Kinsey and so many other wonderful ladies have been able to plant and nurture can now grow at a much larger pace throughout the organization. Next slide. I do want to talk about this because this has really been important and integral to the development and the motivation behind the SRG overall. A few years ago, when we started talking about this, most organizations had a Vision 2020. We have long passed Vision 2020. And as an organization, we really had to look at what do we want the next 5 years to look at. Our mission and vision is very clear. It's to improve health, elevate hope, and advance healing for all, and to really be the national leader for health, learning, and community. But when we think about that, there are many strategic imperatives and strategic priorities that guide us through this work. And thankfully, this Impact 2025 has been very instrumental in how A2We Excel has been structured. And Kinsey will talk about that in a second. It really hits, if you see that 9 boxes that are there, it hits teammates and culture. It also improves growth, integrated scale, and influence, particularly when it comes to social impact and health equity, and puts us in a unique position, in my opinion, to be able to address the needs of so many of our minority communities, but those who have issues around social impact drivers, because many of the women who we participate with in A2We Excel understand what it's like to be in a marginalized subset of our community. And so, Kinsey, I will turn it over to you because I'm super excited to serve as your sponsor, but also excited for you to share this work nationally with as many people as who can hear it.
Thank you so much, Asha. Again, we are super excited to talk about this work. It's just so incredibly important to us. So next slide, please. Asha mentioned our vision and our mission and our strategic plan, but I think it's worth noting that as an organization, we also have a specific DE&I agenda that is connected to our strategic plan, and we refer to this as our bold goal. And here, the principle behind this work is really to achieve transformative equity in healthcare leadership, our workforce representation, and with our learners and communities. And we've learned that if we're going to be successful and if we're going to impact our bold goal, we have to have an impact in each of those areas. Next slide, please. So to really help us reach this bold goal and drive outcomes across the different regions, we do have a powerful infrastructure in place through our system resource groups. And these groups help us with many tasks, from cascading information to boosting engagement, all the way to building and supporting inclusive workplace culture. We also use these groups to really serve as force multipliers for us. We have a lot of work in the space of DE&I across all of our system resource groups. So we tap into these groups to help us reach our goals and to accomplish all the work that we're called to do. Next slide. And here's just a list of some of the groups that we cater to here at Atrium Health, ranging from UNITOs to LGBTQ, veterans, African Americans, and many, many more. The most important thing to note here is that if you're going to have a strong, effective SRG, you must have an executive sponsor with influence in your organization. Executive sponsors really help drive outcomes and drive the work. So it'll be a key to have an executive sponsor connected to each of your SRGs. And now I really want to talk about my favorite system resource group, African American Women Exemplifying a Commitment to Equity and Leadership, or A2We Excel, as we affectionately call it. We were an informal networking group that started back in 2014 with the goal to become an official SRG. And so we're proud to say in February of 2020, we launched. We were there, we won, right? And our goal from the very beginning has been to set out to do critical work that would advance workplace culture and commitment throughout our enterprise. A2We Excel provides opportunities for African American women and allies to grow, develop, and expand their knowledge base while fostering those meaningful and authentic connections throughout our organization and in the community as well. Next slide. Our mission and vision has a very special place in our hearts because it keeps us inspired, and it also serves as a beacon of hope. Sometimes it feels like we're not progressing as fast as we like, or sometimes we're facing challenging situations. And so we refer back to our mission and vision. And true to our mission and vision, we serve as a safe space for over 2,000 women here at Atrium Health. And we address their specific needs through access and education, leadership development, and those strategic alliances. And from the very beginning, we continue to serve as a resource and an advocate for women across our footprint. And we are determined to have a seat at the table for those pertinent issues that are impacting African American women or women of color in our organization. A2We Excel is based on 3 pillars of impact that help us stay aligned to our mission and vision. First and foremost, we are intentional in our professional development efforts. So we facilitate trainings and seminars that really address the unique needs of African American women. Secondly, we understand the impact that a mentor and a sponsor, like Asha, can have on one's career. And I know many of us on this call can certainly attest to that we probably wouldn't be where we are today if we didn't have a mentor and sponsor. So therefore, we do prioritize mentorship and sponsorship, and we created a 9-month mentoring program called We Excel Together. I'm so proud to share that today we've graduated 2 cohorts, and we are on track to graduate cohort number 3 in May. And lastly, we work diligently to establish partnerships in the community through outreach, support, and education. Here is where we believe in going beyond the walls of Atrium Health. We take it to the community. We take it to the streets, so to speak. I want to emphasize that we could not live out our mission and vision or accomplish half of what we've done or support more than 2,000 women without the phenomenal women on this slide here, these beautiful faces. They are our steering committee, and they lead with so much passion and commitment around this work. We often refer to them as our secret sauce, our main ingredient to our secret sauce. We would be lost without them as co-leads. Most of the committees here listed are self-explanatory, but I do want to mention 2 committees in particular, our ambassadors and our signature events committee. Our ambassadors committee is responsible for the connectivity across our organization and our geographical locations. And a very interesting fact here is this committee was formed in response to the pandemic. As many of you can recall, the pandemic left us feeling isolated and lonely, and we wanted to respond to many of our teammates who shared that feedback with us. And so in a virtual environment, we created opportunity for togetherness, for connectivity. Again, that safe place for our African-American women. So we held virtual game nights, virtual wine tastings, movie nights, self-care sessions, you name it, we did it. All to make sure that we didn't have, we faced that challenge, or we beat that challenge of feeling alone. Also, our signature events committee, go back a slide for me, I'm sorry. With our signature events committee, I'm so proud of this committee because, again, this is where we took it beyond the walls of Atrium, and we addressed heart disease in African-American women, which we know is the #1 killer of African-American women. And so we have a Heart Matters conference, an annual conference each year that's really geared towards preventing heart disease. Over the duration of this conference, we provide education, health screenings, self-care tips, self-advocacy, and much more. We also, I want to really express the magnitude of this conference because it is a huge collaboration of our SRG, our Sanger Heart and Vascular Institute, community partners, as well as Live Well, which is our internal well-being platform here at Atrium Health. This conference takes us over a year to plan, but we are so excited about the lives and the individuals that we're impacting through this work. Next slide. So since launching, we hit the ground running to create, harmonize, and execute programs and initiatives that would impact our members. I think something that always stands out to me is how quickly we were able to pivot during the pandemic. As I mentioned, we launched in February, just before the pandemic hit. We had an in-person event and we were gung-ho, ready to go. And then a few weeks later, the world shut down, right? And A Square We Excel had to make some decisions. We were at a crossroad. We had to figure out if we were going to pause this work or we were going to keep moving forward. It took us months to plan. I put together our strategic plan, but only 2 hours to decide that we had to meet the needs of the women in our organization. And so we were going to move forward. And so we took everything and we moved it to a virtual platform. We mobilized our members and we kept them highly engaged, specifically around professional development opportunities and self-care sessions. And also with the support of our executive sponsors, Asha being one of those, we launched our talent and acquisition initiative, which is aimed at attracting, recruiting, selecting, retaining, growing, and engaging African-American women across our enterprise. And when I say that we lead with intentionality to ensure that there's representation here at Atrium and also in the community, we lead with intentionality. We also partnered during the pandemic with local women's shelters to donate supplies and goods. And through our strategic collaborations, we also supported our Black and Brown teammates across the organization. And one of the ways that comes to mind is our response to the community unrest and the murder of George Floyd. With the Office of DE&I, our Men's Diversity Network, System Resource Group, and our senior leaders, we worked together to put together a 3-part Courageous Conversation series, which is still talked about today, and we're very proud of that. And all of this amazing work has led to us winning SRG of the Year for 2 consecutive years, and we are going for it again this year as well, most definitely. So to tie all this together, none of what we've accomplished would be possible without our solid infrastructure, our strong partnerships, our strategic and creative communications, and the voice of our membership. These are the keys to our success. We meet regularly, and we are very intentional about planning programs that meet the needs of our group, of our membership. We also solicit feedback from our membership because we want to make sure that we're measuring our effectiveness. We don't want to just do programs and events just to do programs and events, but we want to make sure that they're impactful. We keep our members informed and engaged through creative and strategic marketing and communications by leveraging our internal social media platforms, and we stay connected to our executive sponsors. We have a monthly meeting with our executive sponsors who are highly engaged in this work, and we're so internally grateful for them because they not only want to hear what's going well for us, but they also want to know what are some of our challenges, what are we facing, because they want to help us eliminate those barriers. On top of that, they also want to be the voice in the rooms where we're not always represented. And lastly, the Office of DE&I and our HR partners are some of our biggest supporters, and they're very deliberate in their approach to this work. So the running theme for us this year has been to strike while the iron is hot. And needless to say, they have not let up on their intentions to strike while the iron is hot. And we've been so grateful for them because our patients, teammates, and our community have greatly benefited from this work. And next slide, please. And speaking of solid partnerships, and I hope she's on this call, I would like to highlight someone who has been one of our biggest champions and avid partners in this work, Mrs. Peggy Harris. Peggy is amazing. She keeps us inspired and encouraged to walk boldly in our purpose, and she helps us develop those strategies to really go out and reach the masses. Peggy was so instrumental in helping us transform this informing networking group into a formal SRG. And she also can account to that we bugged her for over 6 years to make this thing happen. So Peggy, you are truly a gem if you're on the call to our organization and to A Squared We Excel. And we are so honored to work with you and to have you working with us in this space as well. I'll take a moment to turn the mic back over to Asha.
Thank you, Kinsey. So I'm hope that folks are taking notes and really starting to think about what Kinsey has shared. I think the key in all of this is really being able to create a safe space where these women can share their thoughts, their ideas, their concerns, their desires, not only for their professional growth and development, but also for the communities that they live in, work in, and how they can create a larger impact collectively. I was going to say, Kinsey, you did a phenomenal job. And personally, as a sponsor, this was an opportunity for me to kind of get you out there nationally. And I want to thank Taylor and Ogechi and the AHA for giving us a platform to share this work. It's not often that we get to have folks share work that really propels, I think, an organization. And when Kinsey shared earlier that we started this in the middle of the pandemic, she's not kidding. It literally was just a few weeks before things shut down, but the concern was shifted from, okay, we've started this, now we recognize that these women can end up severely isolated in this process. How do we make sure that they stay connected throughout that? And I do think because of the structure that existed, we were probably able to retain quite a few individuals, but also leave them feeling more vibrant and impactful in their individual roles. Because I would say that, like you all, a lot of the work that we did moved to remote. And if you weren't in a clinical setting, and a fair number of our members actually work in remote capacity. So I think that's been profoundly impactful. I did want to highlight that, Kinsey. I want to talk about why I serve as an executive sponsor. Personally, for me, I live on the diaspora. I'm Afro-Latina and Indian, and so this gives me an opportunity. I recognize the privilege that I have and the platform that I have to be able to support this work. And to whom much is given, much is required. I'm sure many of you have heard that. So I personally do this work. We say we have here good for personal growth. I would say it's good for mental health and professional development. I could not be personally satisfied in the work that I do if I knew that we weren't actually advancing and moving ahead, others behind me, above me, around me, frankly. It also provides me a great opportunity as a leader to get to know other teammates who I may not have a chance to engage with. And it helps me to also build trust in the initiatives that I have been working on personally. My hospital is 457 licensed beds, but we have about 4,000 teammates that I could encounter on any given day. So this is also a place for me to be able to demonstrate my commitment as a leader to DE&I. But bigger than that, I would say justice and transformative equity, like Kinsey spoke about a little bit before. And it's good for business. It does create a space that allows me to have a conversation with my team around how we link the larger strategy for the organization and then our very specific culture commitments. We talk about the culture commitments, but they're really specific behaviors as an organization that we want all of our teammates to fully embrace. And I want to be clear, this is not a panacea. For those of you who work in DE&I, you know this is very, very hard work. And for every time we move ahead in these conversations and we support, we also have some major opportunities that exist. And Kinsey and I can attest to the disappointments that sometimes we experience in terms of the pace of the work. But in general, it has given me a stronger sense of purpose as a leader in our organization and helped me to derive significant satisfaction knowing that I'm able to do this work. I would also say one thing that when I talk about good for business, and I mentioned this earlier, we in healthcare have a tendency to create solutions for the marginalized based on what we think is the right thing to do. A2We Excel gives us a space where we haven't gotten there yet, and this is the next iteration, truly, to help inform health equity work on a larger scale. I will say that Kinsey talked about that Heart Matters conference, and that was a chance for us to get Black and Brown women in front of a Black and Brown community saying we are a trusted partner and we understand, or we may not understand, but we are willing to support you in our community because we share a lived experience. And I think that is another unique opportunity for organizations to use the teams like this as force multipliers, with a caveat, however, that you are very intentional in being able to provide value to the member of the affinity group. Next slide. I do want to highlight Carol Lovin. This is also a huge opportunity for us. I serve as a co-executive sponsor alongside Carol Lovin, who's our system. She's our chief, and she's our enterprise EVP, Chief Integration Officer and System Chief of Staff. She serves directly in support of Mr. Eugene Woods, our CEO for the organization. And let me tell you, that is huge in order to get support. I also think it is very obvious Carol's a white woman. So one of the things that she's been clear about is I don't understand everything, so help me understand what I'm missing. And her humility in being able to say, walk me through this has been incredible. She has been a champion for this work, but she's also been very, I would say, intentional, humble, and she's come to the work with such an open heart and mind. We're very grateful for the work that she's doing, and she's also helped us to seek the right timing on when to move ahead particular concerns or initiatives. So we are ever grateful for her support. She's not on this call, but if you guys know of Carol, this is another opportunity for us to shout from the rooftops that she is definitely interested in the empowerment of women and all women for that matter. Next slide. I talked a little bit about some enablers at the very beginning, but I would say it's very important to have executive level commitment because things will get hard. And it's not that people aren't interested in supporting women of color, but sometimes people ask, well, we're doing all of these other things. Why is this important? Why can't this fold into everything that we do? Well, I can tell you that it does not work for women of color. You've got to be able to have a different approach in terms of how you engage and help to develop trust, but look for very unique solutions to address the issues, both especially because of the intersectionality between race and ethnicity discrimination, as well as gender discrimination in healthcare. And the other thing I would say is you have to support time. That's a very clear, there's a lot of time that goes into it. And I have to give a huge shout out to the team for the work that they do, most of which they actually not just do some of it on work hours, but they do a lot of it on off hours and on weekends, but they do it willingly and supportively to one another. Alignment, I think, is very important. We talked about the Impact 2025. It's very important to continue to make that connection because I think your organization will require that for whatever commitment is necessary. And thankfully, Kinsey, some of the programs we've done have become HR initiatives, but they're not necessarily budgeted A2We Excel initiatives. There's a very small budget that goes into that, but it's nominal and just an effort to create some networking opportunities. I think the governance structure is very, very key because it gives women in the organization. We have over 2,400 women who participate. And this is just in the Atrium region. This hasn't even made it across our entire organization. And I want to highlight this because when we started this work, we didn't know how many people. Kinsey, if you recall, we had a conversation. It was late on a Tuesday afternoon. It's about 6 p.m. It was, what if we do this and it fails?
Mm-hmm.
Right? Do you recall that discussion?
I do.
And A2We launched, and there was a clamor of women signing up for A2We. People came out of the woodwork. So don't underestimate the interest or the desire or the need that women of color have in your organization, because they are looking for collective safe space, and they can create that for themselves. But this governance structure also gives you an opportunity to create productive activities and channel a lot of that energy into spaces that give these women chances to grow, to develop, but also to very productively and constructively channel their concerns. And then I'd also say that cross collaboration and allyship piece is important. A2We does a lot of work, not just with that particular group, but you heard Kinsey talk about the service line collaboration, the work that we do with there's a men's diversity leadership network. There's a women's executive leadership group. We are looking very intentionally to connect with HR. Talent acquisition is involved, and they come to the table asking and seeking feedback from A2We. So there's a lot of opportunity there for cross collaboration. I think those are the things, these are the 5 keys. Kinsey talked about 5 keys for A2We, but I would say that these are things that regardless of what type of system resource group you have, I think it's very, very important to make sure that you're willing to make that commitment as an organization to be able to make that work. And that has been very successful for us. Next slide. The role of executive sponsors, I'm not going to go through every single item that's on here, but I would say our role is an influencer. Undoubtedly, it is our opportunity to take what is happening in an SRG and to make sure that we're eliminating barriers, connecting with folks, talking about this work in other places. What should underscore this is an amplifier piece, but you've got to be able to advocate and talk about this work outside of just the group. And that has been a bit of a challenge during the pandemic because most of the work happened for 2 years underneath the pandemic. So we are really in a space where we are continuing to share this and talk about it at larger groups and identify who are the executive key stakeholders we need to engage with, because now we really need to move to that sponsorship piece that Kinsey was talking about. Being a strategist is also really important. There are times when we meet with the chairs and they'll come to us and go, we want to do this. And we go, let's really think about how this will play out. Let's think about long-term, what is the strategy? And that takes some work. And it doesn't always feel great, but it is always about being the most effective. You also have to be an innovator. We will sometimes, I'm sorry, Kinsey, let me apologize. I do get some ideas from time to time and they humor me, and I'll send a text or an email at strange hours. I admit that, but they also know not to not respond. There's no requirement to respond, but we have a rapport where we throw ideas back and forth with one another with the hope of being able to solve root issues for the team. And I'd also say being a mentor and a coach. If you're not willing to do that with the chairs, then that's a missed opportunity for their learning and their development. At the end of the day, you really want to be able to empower these women to take on concerns or issues, not just in the resource group, but really in their own everyday lives, in the communities they work in, or in their service lines and or their respective direct reporting relationships. Next slide. I do want to talk about this. This is a pretty important part of the work that came to A2We. We hit a bit of a pain point as we were working through things. One of which was we started talking about how do we support women of color? How do we advance them in the organization? We already know that healthcare has a largely disproportionate number of female or women teammates. What we don't have is them at executive levels in the organization. And that number seems to be even harder for women of color than it is for men of color and or our women or white women. And so how do we create pathways for these women to move along? When we first started having this conversation, we started talking about stories of progress, and the team kind of take a step back and say, well, wait, hold on. We're talking about the people have moved ahead, but we're not talking about why people aren't moving ahead. And so Carol and I had some really frank conversations about where the opportunities could exist. And we made it a point to challenge our HR partners and say, we're not going to talk more about education. We agree that we can do mentorship, but that is not going to be the path. How do we really address at the root cause why women of color in our organizations are not advancing in executive leadership roles? And so much credit to talent acquisition and DE&I for saying, we are going to take a step back. And you see this letter that Carol shared. We went ahead and leveraged her leadership as a chief of staff and EVP to say, Carol, you've got to put your heavy on this. And they came back, and they really came back with a rather impressive strategy. This is going to be hard work with or without a strategy to really drive attracting, recruiting, selecting, retaining, and growing, engaging these women. So Taylor, I don't know if you can move to the next slide. I don't know if we have the Aspire. Oh, let's move back. I will say that there's one very unique thing that we are doing currently that I'm very proud of in the last year. A2E Excel challenged the HR and talent acquisition team to look for ways to address these issues. And so our programming now is not focused on how to educate or to mentor for a woman of color to navigate a traditional system, but it really is about helping them to identify unique barriers that typically women of color will experience and giving them strategies on how to navigate that. So we have developed a cohort program called Aspire, where those women of color in A2E Excel, or throughout the organization for that matter, were identified as high performers and paired with a potential executive sponsor, or what we refer to as a navigator. And so that connection point with another person creates, in our mind, a win-win, which is those individuals now are learning what it's like to be a woman of color navigating the career environment, but those women now have insight and support from another person who's actually made it. And so the program is not finished, but there's lots of resources and tools, and the education, again, is really focused on barriers unique to women of color. We're not done yet. We're going to take it up a notch, but I think that this collaboration would not have come about without very strong executive sponsorship support. Next slide. So I do think that the executive sponsor's role really is to look at removing barriers in all four of these buckets. You heard us talk about the systemic ones and our opportunities that exist there. I would say to you that Aspire right now is trying to tackle the interpersonal and the internalized barriers. I would say we still have a fair amount of work in the institutional and systemic barrier box, but we are having conversations that we've never had before as an organization, and they're painful. And we're not having it everywhere we need to have it, but they're happening. And I think that is something that we didn't have before in an organization. And I think there's a testament to the fact that 2,400 women signed up with hope in their hearts that we would be able to create a space for them to be able to move ahead, potentially in the organization, but really find themselves getting as much value as they can from the employment relationship that they have. I will say that some of the conversations we've had has led to us helping to influence some changes in policy around transformative equity. For example, reimbursement of education for some very specific roles we have been able to push. And it wasn't just A2E Excel, but it has been something that was raised by A2 Excel and echoed by multiple other stakeholders in the organization, which was to make sure that for our lower wage employees, instead of doing tuition reimbursement, we would prepay their tuition up front. And so I think that there are benefits from leveraging these discussions with individuals who understand what it's like to be marginalized or to support marginalized and oppressed communities. And I think if we are using affinity groups as thought partners, we will be able to do that. So I think our role as executive sponsors continues to do this work, to be able to do this work. But if you are in a space where you are an executive sponsor who doesn't understand that, using the affinity groups to drive that work is fundamental. And I would say you can't walk away from using that feedback. So again, our bold goal really is transformative equity. And I say that because we talk about DE&I, but we have got to really look at how do we change systemically the issues that are, have long, that the system and processes that have long generated the results that we have. So still plenty of work ahead of us, but I think, again, like I said, we're having conversations we've not had before. And Kinsey, I'm not sure if that's my last slide or not. Do I have one more?
No, that's your last slide, Asha. And I think those on the call can now understand better why, when I say you're an amazing partner on this journey, you know, the two things that stand out to me every single time we work together when I think about this work is how you've elevated ACE where we excel. You've really transformed mentorship to more of a sponsorship approach, because one of the things that we've always talked about is we've been mentored to death. I know personally for myself, I thought if I have to go through one more mentoring program, but you heard our cry around mentorship and said, no, these women need sponsorship. And then we also need to remove barriers for them. And so because of your dedication, those are the two things that we are benefiting from. I agree, we have a lot of work to do, but we've come a long ways as well. And so we're so fortunate because of your advocacy, as well as Carol's. We are in a great place to continue to on this journey very strong. And so I'm excited about that. I just want to wrap us up with a few things that we've learned along the way as we embarked on this journey. The first thing we learned was the value of having a safe space for our teammates to share their input and to speak up. So you want to make sure that you're creating that culture of safety for teammates. We also learned very, very quickly that everything that we do has to be evaluated through the lens of diversity, equity, and inclusion. And Asha mentioned this, along with our tuition reimbursement program. We had a policy in place where we assumed that everyone could pay or could be reimbursed for tuition. Well, we have a lot of teammates who can't necessarily afford to maybe pay $3,000 or $1,000 out of pocket and wait to get that money back. So we evaluate everything through the lens of DE&I. We want to make sure that we're listening to our teammates, we're surveying our teammates, but also we're acting on the feedback that we're getting. And so we do that by way of setting up a governance structure that really empowers and supports those who are leading in this space. And here's where the executive sponsor is very, very handy and influential here. You have to have an executive sponsor who has influence in your organization to really drive a lot of these outcomes. We also make sure that DE&I is embedded across everything that we do, from our programs, our processes, and our policies. Again, going back and evaluating those policies to make sure they're fair and transformative for everyone. And then we build accountability throughout our process. We've learned that it's not enough just to have a plan, but we need to have a structure that also fosters accountability and leaders who are leading in this space as well. And lastly, and certainly not least, please make sure you celebrate your wins along the way. We talked about how tedious and hard this work can be. So you want to celebrate your wins, even your small wins. Make sure you pat yourself on the back, because it may not feel like it, but I promise you, you are moving the dial and you are impacting teammates in your organization. With that, I want to say thank you all for your time this afternoon. We have certainly enjoyed talking about this topic. It is one of our favorite things to talk about. It's a break, like Asha said, it's almost a mental health break from the day-to-day hustle of the work and the job. But we hope that we've certainly shared something that's resonated with you or inspired you on this journey.